My name is Jennifer Knox, and I have been working at Cooley Medical Center since 2018. I did medical school at the University of Washington School of Medicine, and then I did my residency training at Chehalis Rural Training Track that was also affiliated with Olympia, or St. Peter's in Olympia. One thing I really love about caring for growing families is that as a rural medicine practitioner, we care for everybody from cradle to grave. However, if you aren't caring for pregnant patients and newborn babies, oftentimes our practice population will just inevitably skew towards the older generations. And believe me, I love caring for my geriatric populations, but a lot of us practice out here for the diversity. So we practice out here because we can see a wide variety of different age groups, people with different medical conditions, people from all walks of life. And so caring for people during their pregnancy and then with their newborn, that enables those in my practice, the people I care for, to, again, just give me a different area of medicine that I get to practice. And additionally, I became a family medicine practitioner because I wanted longitudinal relationships. So I wanted to bear witness to an individual's movement through the life stages and be able to provide them with support and appropriate medical care as it pertains to each stage in life. One thing I always want my patients to feel during their labor and delivery process is I want them to feel like they are being listened to and being heard. And I want them to know that in the vast majority of situations, there are options. Of course, in an emergency situation, sometimes the options become very scant, but I want them to feel that they have some degree of autonomy and control over what is happening with their bodies, with their baby. This frame of mind is informed by my work as a doula. So in 2009, I did a year with AmeriCorps, and I worked as a bilingual Spanish-speaking doula, primarily for recent immigrants. And so before I had any medical training whatsoever, I was providing non-medical birth support to women who had no other forms of support. They were usually single, didn't have a partner or much family. One thing I admire the most about mothers is our ability to multitask and simultaneously organize and juggle multiple realms of family, so of domestic and professional life, all the while raising children. What I hope families remember most about their delivery experience here was that the care is individualized, and the nursing team and myself, we are really putting you at the center of our attention for the entirety of your labor and delivery. A woman can go into labor and delivery having a very specific idea of how they want it to go. So interventions, no interventions, pain medicines, no pain medicines, all of these different things. And then if, an emergency happens and things go sideways, when they study this, they find that the primary thing that is important and that helps facilitate a good experience as opposed to a traumatic one is if the patient felt listened to. So things can go completely off the rails, due to an emergency. A woman can be terrified of having a cesarean and just want a vaginal delivery with no epidural, and everything could happen completely the opposite. Where trauma and bad experiences come in is if there is a sharp deviation from the plan and the woman doesn't feel listened to, or her points of view taken into consideration, or the reasons for the deviation aren't explained well enough. So listening to my patients is what I try to do within every patient encounter. If my coworkers were to describe me in one word, they would say that I am resilient. One thing I love about our OB team is we are so collaborative. We frequently go to one another with questions, with concerns. There is no real hierarchy that I can detect. We have slightly different practice styles, but we all work very well together. And if either one of us is dealing with a complicated or frankly like frightening OB situation, we can always be sure that one of us will be available to step in and help if needed. The one thing that makes delivering babies so special is the look on the mother, and if she has a partner, her partner's face when I place that baby onto her chest. So oftentimes there's tears, or at the very least there's misty eyes, and seeing that joy, relief, love for the first time is pretty cool. You know, you could do this for a long time and still, you know, putting a healthy, vigorous, crying infant onto mom's chest is pretty cool. When patients put their trust in us, it means a lot because, you know, we are a small facility, and so it shows that they have confidence in our ability to manage a variety of different conditions. And I feel that we're able to do that fairly well, despite living in a low resource area, but primarily it means a lot that they're choosing to not go to a larger town to get their OB care, and it makes it all worth it. At the end of the day, what matters most to me are the longitudinal relationships I get to form with patients. So in a lot of areas of primary care, family medicine, internal medicine, doctors move around a lot. So they, you know, in the old days, you pretty much practiced in the same town for decades. And now docs move around a lot. And so you may only have your patient panel for 3 years and then you're off to a different place. And that's largely a result of like kind of the corporate medicine framework that unfortunately is kind of the status quo in our healthcare system today in America. But out here in rural practice, we have a different model. And a lot of us have been here for a number of years. So I've been here since 2018. That's already surpassing the average that family practitioners stay in one place. You know, my partners, my colleagues have also been here for a really long time. That speaks volumes to, you know, the wonderful patient population we are privileged to care for, but it also speaks volumes for the facility and the environment that they work so hard to create, and how they try to retain doctors here. So that's the reason I went into family medicine, is to care for people over the course of years, not to get to know somebody, care for them for a year, 2 years, and then move to a different town. Like that's, it's a different face of medicine. And like, for instance, if I didn't care about longitudinal relationships, I would have probably become a proceduralist or specialist, but family medicine is my calling. So here I am.